Welcome to The Bridge, Your Health, Your Voice, the official podcast to the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. This partnership is created to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Paris Barnes.
Welcome to The Bridge. My name is Paris Barnes, and I'll be your host today. I'm an African-American woman with brown skin. I have on light blue eyeglasses, and I have curly burgundy hair. And today's chat, we're going to talk about health justice and advocacy. Today, we have Bernard and Denise Coley. Can you introduce yourselves to our listeners, please?
Sure, I'll start. I am an Afro-American male with a small fro, light skin, a bunch of facial hair now. As coming out of COVID, my family liked it, so it stayed. I am a research advocate and a patient voice advocate, overriding the area of health equity, and you'll hear more about that as our session goes. I'm wearing a black shirt with a Stanford logo, as I am a graduate of Stanford Business School and Stanford Law School. And with that, I'll turn it over to my wife, Denise, who is my co-partner in crime on this journey of health equity and health justice.
So I'm Denise Coley. I'm wearing my hair back. My hair is curly. I'm wearing a blue blouse because typically when you do podcasts or video, blue comes out much better, so you can see it. I am brown skin, and I'm wearing glasses, and I think they're brown and gold today. And I am...
Welcome back. Welcome home. All right, so I'd like to start our podcast with a little bit of an icebreaker just to kind of warm you up and get you ready to chat. So I'll start with you, Bernard. If advocacy were a sport, what would your signature move be?
So when I heard this question, I cracked up laughing because instead of my move, I was thinking about what it's like to do some of the advocacy. So the first thing that came to my mind was trying to pull down a greasy pig in a greasy pig wrestling match. That's a little bit about what advocacy can be like, chasing that animal. So I'll start with that.
Oh, man, I don't know why I thought you were going to pick like a WWE move or something like that, because that's totally where my mind went. My signature move in all aspects is a sweet chin music by Shawn Michaels. I don't care what it is. That's the move. So that's awesome. Let's see. And then Denise, if your advocacy style were a fictional character, who would it be?
It would be Yoda.
Ooh.
Yoda. I thought about when I first said it, Bernard said, Yoda? I said, yes, Yoda. He's small, green, elderly, commands great respect. He's powerful, and he speaks in phrases. And the most interesting thing is, this is a Star Wars force, but according to the narrative, they said they wanted Yoda to respect everybody and pay attention to the poorest person. And so as we look at our advocacy, we're looking at working with all communities, especially those in underengaged communities. So Yoda is a perfect match. No matter how tiny he is, he inspires that power and empowerment. And that is what we're about.
Well, let me piggyback on that because Paris, Yoda has one of my favorite phrases in working with our community as we go out to go do advocacy. And that is when he told Luke, do or do not. Nothing fries me more than people saying, I'm all excited, I'm going to do this, and then they don't show. Yeah. And I don't mean necessarily physically don't show, but they just don't show up when the time is important. And in advocacy, that's just extremely important. So do or do not.
That's awesome. And Yoda is brilliant. That's such a good pick. Oh, my goodness. Wow. Oh, how fun. Okay, so I always love these icebreakers because it kind of gets our listeners kind of just set in the mood with what we're going to talk about. and it chills us out for like a good conversation. So obviously we definitely send you the questions ahead of time for a little script, but I may go a little off script. So bear with me so we can have a fun chat about this thing. All right. So can you tell our listeners how you were connected with the patients program? Like, how did you find us?
All right. So I actually do a lot of posting, and your program came across many times. I even talked to my niece who went to University of Maryland and told her about it. And then last year it came across again. But this time it was from somebody who attended the class, and that's Esther. And so Esther said, "Hey, you guys should check this out." So I checked it out and I said, "Oh, well, it's virtual, so I can do it," because I thought I would have to fly to the East Coast. And I was absolutely phenomenally amazed, awesome, great program. And it really connected us to people who we wanted to connect with, not only people with our disease, but with other diseases who are looking for empowerment, looking for equity, and looking for collaboration. So that was how I found out about the program.
So for me, and I'm not doing this to stroke your ego. This is true. I think, and I shared this in the class. Denise came to me and said, we ought to, participate in this program. And my plate is always overloaded. So I was like, oh, here comes another one of these possible boondoggles. And then so I paused a little bit to do a quick little research, and I came across the podcast, Paris, that you were interviewed in. And I left that podcast saying, I'm in. And I'll highlight just a couple of things that you said. First off, joining these things for me is the other people that are in there. Like attending a school, it's your fellow students you're going to learn more from. So it's important who's in there. But when I heard your podcast, you talked about empowering the community. You didn't talk about just running down and raising your voice on some cause. You said, no, it's important for us to educate the community. And that resonated with me right away. That was one of many things that resonated. You were referred to as the silent giant. No need to run out front. You're for you. The important thing was to get things done. And if you read, we co-founded a special interest group, Black Diaspora, and one of our fundamental tenets is generating pragmatic and practical solutions. And in fact, we have many offers for people to go do something. And we said, well, only if it's going to lead to something practical and pragmatic that can be implemented. Life is short, and we've lived quite a life, so we don't have time to just sit around maybe sometimes and just brainstorm. If we're not going anywhere with it, it's not a good use of our time. And as I heard you in the podcast talk about those things, fundamentally I said, you know what, I want to be in the room with her. If she's part of the Patient Professor Academy, I'm in. And that's actually what made me go back to the said, okay, let's go. We're in. Thank you all for admitting us to the class. It turned out to be a huge, valuable use of our time.
We're grateful you were there. And I want to just say one more thing that you mentioned, patient-led. That entire program and product is patient-led, down to the application, down to the facilitation, down to the final report. That whole entire machine is ran by our patients and the people who participate in it. And for us, that's advocacy. We allow them to use their voice to advocate not only what we're doing, but what they're doing. And that is our organizational contribution to advocacy. So it was designed and destined for you to be a part of it, because how else would I meet you? How else would you visit Baltimore? How else would we go to Lexington Market and eat Chinese food? And how else would we learn about all the cool things that you're doing across the coast? So thank you for being a part of it and just becoming like forever family inside and outside the program.
Thank you.
Ditto.
All right, so let's jump back into all the cool things that y'all are doing, and y'all doing a lot. So can you explain to our listeners all of the amazing things you're doing and then how your advocacy is tying into that work you're doing?
So I'll begin and then I'll turn it over to Denise. So first off, when you start to look at health justice and health advocacy in the United States, you can't help but notice that there's a huge gap in the Black community um, in terms of value received. Okay, it's just stares you in the face every day. And as you go to try to access some of those resources, you encounter barriers. And at first I thought, well, it's just, we need to get up and go do more ourselves. But once you realize that there are barriers, you realize that some of this is intentional. So for us, we said, hey, we're products of the civil rights era, advocacy and work. And so he said, we've seen this movie before. We know how this plays out. We need to take our talent and repurpose some of what my wife had us doing and we were doing together um, over to this particular aspect of health equity and get to work because it's not going to happen without people uh, from the community leading the way, getting it done. Um, it's not some of this stuff is not just a social righteous thing. Yes, it is, but some of it is just, hey, um, there are people who believe that the pie is only so big, and instead of growing the pie, they want to make sure that they take most of the slices out of the pie. And we said, okay, we have work to do. So we formed Special Interest Group Black Diaspora to focus on these health equity issues, to focus on specific challenges as they come up, but to do two things. Always do our project in a collaborative mode because we found out that works better for bringing about real lasting change. So we collaborate with the organizations that have the barrier because there are many well-intended and good-intended people who don't understand how systemic some of these problems are. So part of our job is to build the bridges um, uh, with them on one side and us and us our community on the other, and us in the middle as a bridge, and educate both sides and get both sides in the room because only through that collaboration will we succeed at reducing the barriers, producing a sustainable environment where there is health equity, where those valuable resources that they have in Fort Knox actually make it across the bridge over to our community. So we formed Special Interest Group Black Diaspora, and then we started it was easy to identify the gaps. Then we started building processes to address those gaps. So in the health area specifically, my wife, and I'll let her tell you the details, recognized that there was a gap between the Black women and the organizations or tools that were set up like support groups, things like that, to help people who are on this journey who are struggling.
In 2018, I received a diagnosis that sort of shook my ground and turned it upside down. So I gave myself an adequate amount of time to decide what it was I was going to do. And it took about 3 months or so to figure it out. But the point was, I wanted to look at the gaps and solutions as Bernard talked about. But first, I had to figure out what was the structure, what was the purpose and the mission and vision. So I said to Bernard, well, I think what we'll do is we'll form Team Coley to go after these two things, the gaps and the solutions, because we both have unique backgrounds that would benefit to turn it on to advocacy for this organization. But the most important thing was that we had done this before in another area. We had done it with diverse businesses to get into the supply chain of corporate America. And so we made a lot of contacts in different communities throughout the world. And that's what this was screaming to have the same thing done. So what we did is we formed SIG Diaspora, which Bernard has gone into detail about. And then we looked at, well, what is it that really is needed? So from a patient perspective, I wanted education. I wanted knowledge. I wanted resources. I wanted research on particular communities and cultures, and also how could we have quality of life. So we created the Sikh Black Diaspora, and I created a social networking group where Black women who are care partners and people with Parkinson's could come together every month, not to necessarily discuss Parkinson's disease, but to have fun, to laugh, to share, listen to music if we want to, do art if we want to, talk about history, but just a community because we wanted to create a safe space community for the women to be open to talk about what's on their mind. So that was the first thing. And the way we went about it is something similar to what happened with PPA. I uh, brought up my mission, vision, and goals, and I met with about 4 or 5 medical professionals from MDS to neurologists to social workers to program directors. And I said, I see this gap, and we can't do it just with women alone who are care partners, and we can't do it alone with women who are people with Parkinson's, because at this point in time, there have not been enough identified to do that. But we can surely bring them together in a mixed group for a networking social group. And that is what I did. And it's been quite successful. And then the last thing that I'll talk about is there is a book called PD Movers We Keep Moving. And so that is one of the things that we participated in with about 10 other people who were care partners and people with Parkinson's to talk about our story. And that was so powerful. That was the first time I decided to write my story. And it took a prolonged time to do the story because what part of that story would interest people? And so we had to find out what is it the community was looking for so that they could relate to what we're struggling from each day. So that's it.
So now you recognize some of our strength, because I'm going to bottom line is I held back on this point earlier. The other thing that PPA emphasized in their promotional literature was that it was a primary motive of yours to build community.
Yes.
And we just picked up our strategic plan and went, gee, they read our strategic plan. So what we'll tell you is that underneath of a lot of the things that we do is the emphasis on building community. And so people said, well, we have a Black community. They said, yeah, we all live in the same neighborhood, but you all don't know what community meant to us 50, 60 years ago. It was different. Neighbors took care of neighbors usually. You have many communities today, including ours, where people don't know the people next door. And they don't know the person across the street.
Or have a porch.
So what we said was, hey, we were losing this sense of the community, which created the energy, which developed the resources, which did the things that help us not have these gaps. Once you take away the community, the gaps just open up. So that was part one, the community. The second thing is, and this is funny, because so just a quick bullet point. We created an annual Black Parkinson's Disease Summit in a safe space where our community can come together and talk about a brain health disease. You say Parkinson's, boy, they're gone. Okay. But we created this space and we're successful at creating the largest attendance in a single place that you see out there in that space. So that was one, the summit every year. Denise mentioned Shades of Strength, her female group. Well, another group that's missing in action a lot of places is Black males. So I created the barbershop, and the men are showing up and we're building community in it. So community building and safe spaces. And then the third component, and this is part of what cracked me up in the health equity area. So there are a lot of people that go out and they create a lot of resources. And if you look at them, they're scientifically good. I mean, they're great. Problem is, they're not making it across to our community. They're not presented in a culturally sensitive way. They're not presented in a plain language way often. So that creates a barrier for our community. So we added something to our activities, and that was, and Denise hinted at it, storytelling. And it's funny because we not only told our story in the first PD Movers book, and we'll give credit to Dr. Harold Shaw and Mrs. Anita Parker at Columbia Medical School for the work that it was their idea to create a book of stories that of just the Black community, talking about how we live with Parkinson's. We've taken that a step earlier. So as I was bullet pointing, there's the summit, there's our networking community groups. We took over and patient led the latest edition of the PD Movers series, and it's called PD Movers We Participate in Research. Because another gap is that we often put stuff in us that's never been tested on us in the medical area. We often engage in treatments that we weren't involved in developing. And I was like, and you ask the question why it's not working, boom. So we went to this storytelling mode and we pulled people together from our community to talk about what our experience is today. Not 50 years ago, not the ski, not all the stuff that another community likes to run around and say, that's the reason we don't participate. We're not denying a legacy. That absolutely is true. We acknowledge it a whole bit. However, I'm not going to keep putting stuff in me that's not tested with me and for me, and in some cases, by me. And we've done that a lot, and that's had negative health consequences. So we took the storytelling, we do it culturally sensitive by definition when it's patient-led by members of the Black community. We don't have to be told how to do it, we do it. But more important, it's a better vehicle for educating our community. So the work that we've done has generated a lot of excitement because we built it around storytelling and engaging. So I don't like to use underrepresented or underserved. I like to use the term underengaged.
Underengaged. Okay.
Underengaged, because that's a part of the health injustice and health inequity. You haven't, nothing about us without us, and I like to say, speak to me, not for me. Okay.
And listen to me.
I'm an advocate. I can talk to myself. And by the way, all these people that you've excluded, hold my beer for a minute. I'll be back with 100 of them. And they'll explain what's going on. Okay. So we are underengaged. And the important part about that term, underengaged, is it points to the solution. The solution is engage with us, collaborate with us, talk with us. And as a third pillar, and I'll give you the last pillar now that I was holding out on, that the other leg on the chair is uplifting Black excellence. Part of our challenge when we go in to speak to the medical community is they don't listen to us. So our community doesn't trust us. Doesn't trust them. Okay. So what's the problem? Part of the problem is they see a victim. They see somebody that they paternalistically have to help. Okay. But not just in the science, all the way around. So they decide things for us like, oh, you're not going to participate in that clinical trial. Oh, you can't afford this treatment, so I won't even tell you about it.
Or you won't complete.
Or you won't complete it. Say, excuse me. So part of what we do in these vehicles we create is we uplift Black excellence. We have a lot of talent in the Black community. So during Black History Month every year now is when we hold the summit. And part of the summit is we raise the awareness of our Black doctors and MDSs and our researchers who are part of developing the solutions. And people are like, oh, I didn't know. And I said, yeah, I know. That's why this is one of our fundamental pillars, is to uplift the Black excellence that we have, to show that we were there all along. Many things were invented by us, but also we have talent today, which you are not engaging with. Okay. So community, using storytelling, uplifting the Black excellence while we're doing it. And the room is full of our folks. So that's what we're doing and demonstrating that when you do it with respect, when you do it and you treat us as peers, when you let our voices in the room, you get these solutions. You get working solutions. So that's us in a nutshell.
And social workers.
Oh, well, we include everybody. I mean, Denise was just whispering to me, one of the other tenets we have that surprise some people when they see our group is I have a belief that I don't know how you create a decision if everybody, all the stakeholders aren't in the room, which is the
Right.
thing I liked about PPA. It's surprising to me that people will develop something, go out and say, we got it. And then it goes out and fails. And they say, I don't know why it failed.
What
And then you go,
happened?
"Yeah,
Yep.
look at who was in the room when you did it. You left people out." So one of the things that happens is we have our meetings in strategic planning is we have social workers, people on the front line, patient coordinators, as well as the doctors, as well as the researchers, as well as the impacted community and their family members.
NPT,
And,
yes.
yeah, and just about everything. We get the people who have a stake in us in the room for the dialogue to talk about it. And that's in our abstracts, by the way, that we present. It always has those couple of buzzwords in there: patient-led, all inclusive. And so to me, it's like I'm scratching my head. Why did they think this wasn't going to work?
It seems so simple, but and it seems like it makes so much sense, but for some reason, it's just like not implemented. Um, and you said something that really stuck out to me that I'll probably hold on to forever and never is that certain communities are under engaged. And I admitted this to you when I first met you. When I thought about Parkinson's, the first thing and the only thing that ever came to my mind about it was Muhammad Ali. It's all I knew about it. It's all I heard about it. So to me, it wasn't something in the forefront of my mind, nor was it something that myself, as well as the individuals within my community and age group, know about. We just weren't educated on it. We just didn't associate it with it being a disease that African Americans get. And if I'm being honest with you, we thought he got it just because he got punched too many times. So we just really didn't have like the actual understanding of what it is. And it is by design. There's no reason why we kind of weren't distributed that information. But we just didn't know. We just assumed, okay, he got it because he got punched too many times, and that's all we know about it. The end. That's all. But as I'm talking to you, and we're from two different generations, I'm understanding how that lack of information contributes to lack of outcomes, as well as lack of improvement and lack of innovation. Because if y'all didn't get it and the people in between you didn't get it and we didn't get it, that's the gap. And what you're saying is you have identified that gap and that's your life's work. You figured it out. Like you figured out the secret sauce.
And that's really important because when you think about it, it was discovered in the 1800s. And the picture you usually see is an old white man with a cane. Well, that's what's been taught in medical schools and that's what's been taught in families. So for a Black culture, we don't really want to talk about disease. So you have to go through the history to get it. So what I had to do when I was diagnosed, I had to go to my aunt who was turning 100 to ask, had there been any people with Parkinson's in the pipeline? And of course she answered, and I have that now. But I'm sure there are a lot of families that have the same thing. But as Bernard likes to say, if you go to church and you say, do you know anybody in church who has the shakes? The hands go up. But if you go and put your hand down, and Bernard says, hey, anybody in here have Parkinson's? They look
Yeah.
around, what is that? So we had to start from that groundwork of education and resources and help for the families and quality of life so that it was a known fact that we could actually empower other people to make sure they know that life can be different. It is a disastrous moment when you get the diagnosis, but you can live a good life, a quality life.
So this points to one of our favorite projects. So we talk about pragmatic solutions. So once you identify the fact that our community was unaware that we got it, one of our first and favorite projects is the Parkinson's disease Black family quilt.
Yes.
And it's modeled like after the HIV quilt. And so we started taking pictures, asking permission, but taking pictures and soliciting pictures from people impacted by Parkinson's in the Black community. So we had the Black Family Quilt. It's available on YouTube. Any of your listeners can go search on it. We're trying to complete the 3rd edition. But what's interesting is we can play that to people who said, "Well, I didn't. Black people don't get Parkinson's disease." We played it at medical conferences, okay, and it goes on for like right now it's up to 4.5 minutes, and all it is a collage, a digital collage of people with Parkinson's, family situation. I mean, you see the entire array of the Black community in there, and then in addition, we have a section in there on people who are part of finding the cure. And we have the pictures of all the Black MDSs in the United States. We have pictures of researchers, leading researchers who are Black. So it goes both ways, what I'm trying to say here on the bridge. So we both inform the medical community, oh yeah, Denise isn't an oddball. Here's a whole bunch of people like that. But we also inform our community, no, this isn't an old white man's disease. Stand by for a couple seconds as you see your neighbors flow through and the thing. So it became one of our favorite projects because Silent Giant, it quietly says, oh no, this is a misnomer that we don't have Parkinson's disease in our community.
It's over in Africa. It's around the world. And when you look at it, you have to acknowledge it. Even some people who have it will say, but I can't go there. My picture isn't there. Nobody represents me. So that's why we've spent the time looking at developing communities that are safe and people can talk to each other.
Right.
That makes sense. That makes a lot of sense. Oh, goodness. So you recently with Patients Professors Academy, a way to keep engaged with all of our participants, we have them come back and do something called social hours. And it's just a time for us to chat, learn about new concepts, and just figure out where we all are. What are we doing? So last month, we asked them to come back and kind of teach a lesson on advocacy to some of our patient professors. And the session was well received. We do surveys and things like that to collect data on how people received the sessions, and they loved it. It was amazing. So for our listeners who are not patient professors yet and who we know in the future will be patient professors and will be able to participate in social hours, can you give them just like a little appetizer, just maybe one thing that you want them to take away from how to or your advocacy journey that you want them to remember? Now, don't give them the whole secret sauce because they have to become patient professors to come to social hour and hear the whole thing, but just a little appetizer.
I think that the social hour is a great place to meet people across different groups that we can collaborate and learn together how to support each other. So the session I will call out is lobbying, or going up to Capitol Hill, going to the Senate, going to your state, going to your mayor, going to your city council. You can learn in the group how to advocate for that, but also bring other people with you so your voice is heard. And so that is a really important piece for anything that you try. Identify what you're going to try to do, then set the goal, and then collaborate. It means so much more to see a group of people in the room as opposed to one person in the room when you're going forward to talk about what it is that you need and want. And with that, I'll just give it to Bernard.
So, systemic stuff. If you are systemically excluded from policy making, if you're systemically excluded from the table, we love Shirley Chisholm. We were blessed one year to spend 3.5 hours with her.
We were really
and if you think it was just if they don't have a seat at the table, bring your own chair and sit at the table. You think that's all she is? She's an iceberg. There was so much she imparted. But let me tell you one piece, and that comes out of what we talked about in the lobbying. You too can be a very successful advocate. In fact, you advocate all the time. So one of the things we hear often in our community is, I can't do that. I can't do that. And they're not realizing that they were educated to take that frame of mind. Not that you were born and when you're born, the kid gets into everything, all kids, okay? So what happened between the time you were a kid and you explored and chased everything, and boy, did you advocate for yourself, you know, to when we got to be adults and we shrivel and we get back and we talk about what we can't do. Well, that's the cultural education that was imposed on us. So part of our message in the advocacy training is you can do this. In fact, you've been doing it all your life. So let me just give you a couple of tidbits and peel the layers off there you so you can see that underneath of that, you're a beautiful person that's got everything you need to be an effective advocate for yourself, for your family, for your cause. And with that, I'll invite them to, look at the video, the webinar, and to come to PPA.
And I'd like to add one last thing. Reverend Jackson, he was a great advocate for keeping hope alive and working with people throughout. But of course, he was diagnosed first with Parkinson's and then a Parkinsonism. But he shared it with the world so that they could know that they can see that he was a Black minister who has Parkinson's, and he advocated in his space about Parkinson's. So we want to empower people, just as Jesse Jackson had been doing all his life, to be able to act for themselves, act for the disease, act for the community, and act to make sure that we can find a cure or to have quality of life or preventable.
Yes. Ooh, and one of the things you both said kind of leads into our final thoughts and closing. So you said that when we're younger, we already start advocacy when we're young. So what would 15 or 16-year-old Denise or Bernard have to say about the work you're doing now? Would they say, I told you so? Or would they say, do a little bit more?
What were you doing for the 50 years in between? So it was like, why were you wasting time? Uh, no, I think my 15 or 16-year-old self would be very proud today. I come from a family with a legacy of community service. My grandmother is in the Afro-American Museum at Smithsonian, up on the third floor in the community section. She was a midwife who delivered over 3,000 babies without losing one. But what people don't understand, we have this maternal problem now. It's part of it is because we are no longer taking care of ourselves. But what my grandmother did, and people didn't understand, is if you thought of her only as the midwife, here we go with the Shirley Chisholm analogy again, you missed it. Back in the Deep South, when she was doing this work, she was free to travel where most Black people weren't because everybody knew she was on call to deliver baby. So my grandmother was the town crier. My grandmother was the information specialist, the community binder that tied together. There were no Goodwills and other programs like that in Albany, Georgia, in the D South where she was. So she took it upon herself to help our most challenged members of the community get clothing they needed, food, let people know. My dad tells the story all the time because it drove him nuts as they were a kid. So they weren't rich, but my grandmother would come home, make them get out of bed, take the mattress off the bed, take it back to where a mother was going to deliver, and put them on it so that they did not have to deliver babies on newspaper on the floor. Okay. She did things like that. So she was the social worker. She was the social program. My dad complained all the time. He said he hated walking home with my grandmother because he said a 20-minute walk took 2 hours.
Because she was helping people on the way.
She's talking to everybody on the way. The front porch conversation sometimes went all day. That's the role she played in the community. So we understood community development. My dad was the head of the Civic Association in the community where we lived. So, I stood in the back of the room and went, that's my dad. up there in front of all these people. So I didn't have to think about it when I was 16 years old. I was involved in a bunch of stuff because I just thought that's what you do. Um, and so my 16-year-old self would say, yeah, like I said, you wasted those years in between. You should have been doing this all along to help the community, to build, et cetera.
What about you, Denise?
All right. So I thought back in fifth grade, I declared I was going to be a teacher. When I got to college, I said I wanted a profession that helped me reach other people, which came into conflict with what my father had wanted because church and family was all about bringing people together, but you had to help in some shape, manner, or form. So every job that I had, I created my own job, which was to have an education mentoring program. There were no ifs, ands, and buts about it, even if it was going to be a side job. I even created, along with some other people, the first networking group in this particular technical company that I was in. And I did that every place I went and never faulted that it wasn't going to be the right thing, and it was. And that's how I fell into the part with the global for diversity, and now with the diversity for uh, everybody to be included in different diseases to be empowered. So I went from education to mentoring to empowerment. And I met a friend from the past, and the statement was, well, of course, what else would you expect out of Denise Coley?
Now you know why I married her.
It's like that senior superlative, like most likely to shake a table or something like that. That was y'all. Y'all did up knowing that y'all was going to be those people. And if there was a senior superlative in that area, that's what y'all would have got. That's awesome. Well, thank you so much for being a part of our podcast and coming back and speaking to us. I know that this will not be your last podcast because I can think of about a couple more topics that I want you all to come back and do. But we appreciate you at the program. We appreciate that you stick with us and you keep on giving us and contributing to the betterment of the community for everybody. So thank you for being here, and thank you to our listeners of The Bridge.
And thank you for having us.
Thank you so much. You are a light for all of us who've come to the program. You've shone your light, and we hope to magnify it all around the world.
Thank you for listening to the Bridge Podcast. To learn more about the Patience Program, visit our website at www.patience.umaryland.edu.